Happy Thursday, everybody. It's Chamber Check-in time. And today I have Kyle Rooks. And Kyle is the Communications Director for the Idaho Community Health Center Association and Policy Director. Hi, Kyle.
Hi, Paul. How are you?
I'm terrific. It's a beautiful fall day. If you had a chance to get outside and enjoy some of that sun, crisp weather, I love it.
Absolutely.
Hey, I'm looking forward to learning more about the Idaho Community Health Center Association and what it is and how you support community health centers across the state. But first, I get to thank our series sponsor for these check-ins. And as you know, Kyle, it's Delta Dental of Idaho. And Delta Dental of Idaho for the past 52 years now has been providing best-in-class dental insurance benefits to businesses and citizens. And with that, I'm going to share a fun factoid from their Tooth Truth series. Here we go.
So with Delta Dental, our benefits are based on calendar year, and that's per person on the plan. Every January, you get a new annual maximum to use towards your dental care for that year. If your company enrolls on our plan mid-year, we're going to credit your deductibles, and we'll start your annual max over again.
Well, Kyle, my wife and I, we reached our maximum already for this year. That means we're getting stuff done, right? That we're supposed to be getting done.
Yeah.
So, Kyle, tell us a little bit about you first before we dive into the Health Center Association. How long have you been with Idaho Community Health Center? So easy for me to say.
Yeah.
Health Center Association, and then what brought you into the industry?
Yeah, so I've been with the organization for about 2.5 years, but I've worked with them for many years, and that's because prior to working in this position, I worked at Terry Riley Health Services, which is known by many in the Treasure Valley, and so that it's an easy lead-in kind of to probably our next conversation. But Terry Riley Health Services is a community health center, and so the association worked closely with that association over the years. So I knew all the folks who worked at this group. So it was an easy jump in. But I worked 10 years at Terry Riley Health Services.
Oh, wow.
And I just loved the mission. I loved kind of the culture that was built and the ability to help people who needed it the most at different times of need. And so when I realized I could have that same, I could support 16 other community health centers across the state, just like Terry Riley. The job just sounded like a no-brainer, and I've loved working with them ever since.
Okay, that's awesome, Kyle. You learn a lot about people from their previous occupations and what leads them into their new roles and new appointments. So it's a perfect segue into my next question. And what is a community health center, Kyle? Help me understand more about what that is.
Yeah, a community health center is it's another name that they could go by is federally qualified health center. So they have a designation to receive federal support to take care of people without insurance. They offer a sliding fee scale, and so anyone can walk in and if you don't have an insurance card, they'll take you and they'll make payments work for your specific income. But it's important I'll keep going on the what is. And so they also offer integrated services. So within one location, you'll find medical, you'll find dental, and you'll find behavioral health services. And so one of the best kind of practical ways I think about this, let's say a patient comes in for a dentist appointment. Well, the dentist is working in what we call pods right next to the primary care physician and right next to the behavioral health specialist. So while on a dental visit, they may realize that this patient has maybe some behavioral health stuff going on. So then they could get them right away to a referral to a behavioral health specialist. So now that transition of care is taken care of. Then that behavioral health specialist could realize, okay, well, we have some underlying medical conditions. Let's have you see our provider. So it's really a one-stop shop for patients to get the care they need, and they don't have to hop all over the town to get this care. And many of the community health centers have an in-house pharmacy built in as well. What I'll say this too, though, sometimes it's important to say what a community health center is not. So I think a lot of times people kind of get the general idea of who we are and what we do, but community health centers, one of the best kept secrets is they accept any patient, any and all. So if you have insurance, you are welcome at a community health center. And in a lot of ways that helps support the mission. And so it's not just for those without insurance. Sometimes people think it's strictly a free clinic. That's not true necessarily either. They do work off that sliding fee scale. And a lot of health centers do make sure that if free is the way to get somebody seen, they'll make accommodations, but it's not strictly a free clinic. And so those are kind of important to stress. But I think the biggest thing is it's right in their name. They are there for the entire community. No matter who you are, no matter what your insurance status is, they are there.
How many community health centers are there across the state, Kyle?
There are 16 independent organizations, and I should say they're nonprofit organizations. So
right.
Nonprofit, independently run organizations. And a total for clinic sites is 192 clinic sites across the state.
Wow.
So the reach is pretty massive, and they're all united together to drive down patient cost and make sure that people are getting the care they need.
That's awesome. So thank you for making that tangible for me with Terry Riley, because I understand that. What are some other names that we might be familiar with?
Well, here in Treasure Valley, you definitely be familiar with Full Circle Health, and they just underwent a name change. So they used to be the Family Medicine Residency of Idaho. And so they've been a long-standing member of the association and done great work for the Treasure Valley as well. So those are the two Treasure Valley ones. We have in Mountain Home, we have Desert Sage Community Health Centers. If you go up to Emmett, you'll find Valley Family Health Center, Community Health Center. So those are some of the ones in our immediate area.
Okay, thank you. That helps me a lot. And then what is the association responsible for, and how does the work you do support these community health centers?
Yeah, the best way I could say it is we give all these amazing organizations one united voice. So I'll use a really neat community health center in Chalice, Idaho. Chalice Community Health Center is an example. They're the only clinic in town for anyone who needs medical. You're going to Chalice Community Health Center. But by themselves, they probably wouldn't have as strong of a voice on the impact that community health centers make across the state. So they are closely tied with all the other health centers to have one united voice. And the reason that's important is we want to be able to drive down the cost of care for the state of Idaho and for the patients, of course. And so if we can collaborate and connect with one another, learn best practices, coordinate on insurance, then we can make sure that care is affordable for our entire state. And that helps everyone, whether you're a patient or not.
Okay, and I was looking at some of the resources that the association provides, and I saw there's a lot of trainings for docs and stuff. Tell me more about that.
Yeah, so we have a team within the association that is responsible for training and technical assistance. So they'll bring in speakers, they'll bring in providers, and be able to share best practices. And that's extremely important for health centers across the state that can lean on other health centers and what they're doing. So they don't necessarily have to reinvent the wheel. They can learn from their sister organizations. And so we do provide that. Other pieces that we provide as an organization are we help negotiate insurance contracts. And so we'll help to make sure that the providers and the community health centers and everybody's heard. And so that way there's a united connection on that.
Well, they don't have to spend that extra revenue on hiring someone to actually do the trainings when you already have the programs already dialed.
Correct. Yep.
I think that's so crucial to understand. That's a huge service. And then you're talking about shared best practices. I mean, why not?
Yeah.
Right.
And Paul, I got to put this one other plug too, is we have a workforce development department. And so there, every business, as you are well aware, is struggling for workforce, and we're no exception to that. But we do have, a pulse on the state and trying to support these health centers that are desperately trying to find staff members for their clinics. And so we're doing all that we can to make sure that they have the resources for recruitment and retention.
Okay, that's awesome. Yeah, there's dollars there to be had as well for workforce training and development that probably just aren't known. Right? Yeah. I'm glad that you're doing that work as well. So talking about 192 community health centers, how many people is that reaching, Kyle? I think this is important as well. patients or just people in those communities? Tell me a little bit more about that.
Yeah, we just did the math, and the most recent numbers came out, and is 231,000 individuals. But what's more fascinating to me is just shy of 1 million visits annually. So if you think about those visits, if there wasn't a community health center, those visits would be plugging up the ERs, they'd be plugging up other valuable resources. So and what speaks to me about that patient visit component too is that they're finding continuity of care within these clinics. And so something that's really important to us is we don't want people just to come in and with a symptom, they get billed and then they're out the door. We want to make sure they stay healthy. So we're incentivized in essence to make sure that these patients continue to seek care with their primary care provider, and that they can that medical team can make sure that they're staying healthy, and we'll be able to help with any aspect to do that, any referrals or et cetera, to make sure that patient lives a healthy life.
I love it. That's the most important part too. Is the proactive, is it something that humans are very good at, being proactive. And I think if we can learn to be more proactive, that's better.
Yep.
Absolutely. Let's chat about your team for a little bit. I was on the website earlier, and why don't you just kind of go through the talented team that you have?
Sure. Yeah. Reach down, look at our little organizational chart here, but so we have David Garrett as our Chief Executive Officer, and he's been with us now. He's just recently jumped in about probably a little over 6 months ago. We have a great support staff that helps him. We have Amy Luganville as our Deputy Director. We have Michael Ide as our IT Director. We have a Finance Director, and then Susan Alt does our Care and Innovation Director. So it helps really coordinate with those providers. And then, the list goes on. We have an individual that supports behavioral health teams. We have people who help the dental teams, workforce, as I mentioned, and even a recent position that we've put on is a value-based payment manager. Now, this person is to make sure that as we move to this new standard of care, which is to make sure people remain healthy and that there's the best value, this person is there to help the health centers and the insurance companies with that. So.
Okay. Well, we couldn't do anything without our team, and
correct.
Just looking at the breadth of skill sets on the website, I'm just amazed. And so I knew Yvonne Ketchum Ward previously. Now let's talk a little bit about that transition and name change.
Yeah, so Yvonne, I'll probably butcher it how long she's been with the organization, but I want to say 8 years or so. And so, and she's done incredible work for the organization and really took the association to the next level and set the organization up for success moving forward. So can't say enough good things about Yvonne. But yeah, so we with transition, and this is something we've been wanting to do for a while, is really define who we are and our name. So prior to the Idaho Community Health Center Association, we were the Idaho Primary Care Association. And so many of the people listening may know the Idaho Primary Care Association. Well, we felt, and now that is a national name for other partner state agencies, state associations like ourselves, they go by that. They go by the Kentucky Primary Care Association, et cetera, et cetera. But we just felt it led to confusion on who our members were. So we wanted to make sure that right when you read our name, you saw community health centers in there, and that really defined who our members were. There's a lot of great medical practices that provide primary care, and we don't represent all of them. We represent specifically the 16 community health centers. Right. And so we just wanted to make sure that was accurately reflected in our name, so we didn't have to answer any questions around that. So that took place, I'd say about 2 months ago. We did that name change. So. Okay.
And when we were talking a couple months ago, planning for this time for this feature, you had mentioned that the governor had made August Community Health Center Month.
Yes.
Tell me a little bit about that. Help share that story.
Yeah, so we're so thankful for the governor and his team and all the elected officials who support us. But the governor declared the month of August as Community Health Center Month, and just to draw recognition of the impact that we have and the crucial component we are to the medical system across the state. So the governor, he signed the proclamation and just really made it known that community health centers are important to the state. So we're so thankful for him and his team for that.
Well, what you mentioned about the amount of patients that you're being able to connect with and help, and what you said about those patients would be somewhere else,
Mm-hmm.
I think that's so important to focus on, because 1 million visits per the year. I mean, take that on as a St. Luke's or a St. Al's or whatever. I mean, and they're already up against the ropes,
Mm-hmm. They'd be somewhere else, or they'd be even worse without care. And so they would just forego their medical issues. And so if somebody had diabetes, they might ignore it. And then obviously that would lead to massive problems. And then they have no choice but the ER. So if we can get that preventative care done early, we help the rest of the medical system throughout Idaho.
Okay. Well, Kyle, the website and phone number for the association is scrolling on the bottom of the screen. I just wanted to thank you so much for your investment in these community health centers, the Treasure Valley community as well, and then your investment in the chamber. It means a lot to us, and it's been so great getting to know you, Kyle, over the past couple of months, and I look forward to future conversations.
Likewise. Thank you so much, Paul.
Absolutely. Hey, say hello to the team and thank them for their work from us. Have a great weekend.
Okay.